In November of last year, as one of this government's very first announcements, the NDP told the media that new beds would be fully operational at Grace Hospital by the end of March. I'll table the media article where the Minister of Health made this claim, as well as relevant sections from the WRHA's most recent annual report showing not a single new bed was added. Once again, as is typical with this NDP government, a splashy news conference followed by an absolute failure to follow through. Honourable Speaker, where are the beds at Grace Hospital?
Honourable Speaker, I was really proud to visit Grace Hospital and make, actually been there several times to make several really important announcements. However, you might be shocked to know that when we first went there and we visited with the frontline staff and the health leadership and patients, they reported to me that they had never actually received a visit from the health minister by the previous administration. They had never been engaged in planning. They had never, ever been engaged on frontline health care. Now, it's sad, Honourable Speaker, that on that side of the House, they continue to share information that is wrong. On this side of the House, we're going to continue to add beds, add frontline staff, and work with frontline health experts to make health care better, not only in West Winnipeg, but across Manitoba.
Right on.
Perhaps these promised beds could have helped alleviate rising ER wait times in Winnipeg. Instead, Grace Hospital's ER wait times have only gotten worse. Now at a median of 4.92 hours as of August, an increase from 4.28 hours in August the year before.
Wow.
Even the president of the Manitoba Nurses Union told the media on Tuesday, quote, "Wait times are definitely rising in our emergency departments," unquote.
Yep.
So with no additional staffed beds at the Grace, and now with rising ER wait times, does the NDP actually have a plan to address ER wait times, or is it all just about news conferences and lip service to the media?
Honourable Speaker, on this side of the House, we recognized right away the serious damage that was done to our healthcare system by the previous Heather Stephenson administration and members opposite. We got to work right away, adding beds to the healthcare system and adding people to staff those beds. And we're going to continue to do that work. But what are we cleaning up? What mess are we fixing? Well, 7.5 years and a net loss of over 200 beds from across our healthcare system. We are proud to be adding back capacity and working with the front lines to make healthcare better. We will take absolutely no lessons from members opposite who have zero credibility when it comes to healthcare.
Well, nearly a year ago, the minister promised 31 new beds at Grace Hospital, and they said that 21 of them would be operational by the end of March. I tabled statistics from the WRHA's most recent annual report showing that no new beds had been added, and that report's current to March 31st of this year. So the minister clearly didn't meet their commitment to add beds. I actually asked this question a couple of weeks ago in estimates, and the minister didn't have that information handy and promised to get it to me at a later date. I have yet to receive it, but I was actually surprised in the House today that they didn't have those numbers available. In any event, 16 beds is well short of 21. They certainly weren't in place by the end of March, according to the WRHA's own statistics, and it's still well short of the 31 that were initially promised. That concerns me because we've seen ER wait times continue to go up at the Grace, and the minister touted this as a solution to rising ER wait times. That leads me to believe that they have no real plan to reduce ER wait times in Winnipeg.